Do you often feel a dull, nagging pain at the front of your knee, especially when climbing the stairs or after sitting for a long period? If so, you're not alone. In this video, I'll explain what you can do to fix it. I am Dr. Yousefzadeh, specialist in physical therapy, and my goal is to help you eliminate knee pain so you can move freely again. The key point to understand is that our musculoskeletal system works together as a whole. This means that if you're experiencing pain in your knee, we can't ignore the role of the surrounding joints and muscles like hip, ankle, thigh, and calf. To relieve knee pain, the first step is to improve the flexibility of the muscles and soft tissues around the knee. Once we've made progress with the pain, we'll then focus on strengthening the muscles that support the knee joint. In this video, we'll start with improving flexibility, and in my next video, which is part 2, we'll work on building strength. Let's begin by releasing tension in the glutes as they play a crucial role in the smooth movement of your knee. To release tension in the glutes, start by identifying the correct area. Locate the iliac crest, the bony prominence at your waistline. Once you find it, measure about 4 fingers wide below the iliac crest in posterolateral aspect. That's the area to focus on. Place a roller under this spot and gently roll back and forth. Allow the pressure to target the glute muscles, like this. Spend about 30 seconds on each side. If you feel intense muscle pain that's hard to tolerate, reduce the weight by supporting yourself by your hands. Avoid releasing too much, especially during the first few sessions, as it may cause muscle soreness. Next, to stretch your glutes, lie on your back and use the opposite hand to hold the back of the affected knee and gently pull your knee toward your shoulder until you feel a comfortable stretch in your glutes. During the stretch, make sure your lower back is relaxed and comfortable. Hold the stretch for 10 seconds and then switch to the other side. Repeat the stretch 5 to 6 times on each side. Foam rolling is commonly used to release muscle tension, but is more suitable for individuals with a good level of physical fitness. Many people, especially those who are less fit, may find it difficult to use a foam roller. To release thigh muscles, my favorite tool is a massage roller, like this. Roll it along thigh muscles, applying gentle pressure for 2 to 3 minutes on each side. Tension in these muscles can affect knee movement, so regular rolling is important. This method effectively releases the quadriceps, hamstring, and adductors. After releasing tension in the thigh muscles, we begin stretching them one at a time. To stretch your hamstring, sit on the edge of a table or on the floor and extend your leg. Ensure that your knee is fully extended and your leg is not externally rotated. You may feel a gentle stretch in the back of your thigh. If so, hold the position for 10 seconds and then relax your knee. If you don't feel any stretch, lean forward slightly until you do. There is no need to reach for your toes with your hands. Simply lean forward until you do, and feel the stretch in the back of your thigh. Hold the stretch at least for 10 seconds, then turn back and rest. Repeat the stretch at least 5 to 6 times and then switch for the other side. If you have back pain, you might find it more comfortable to stretch lying down. Hold your foot using an elastic band and pull it upward until you feel the stretch in the back of your thigh. Your knee should be fully extended, like this, but the stretch should be tolerable. Adjust the degree of extension to achieve a comfortable stretch. To stretch your calf muscles, fully extend your knee and pull your toes toward yourself. You should feel the stretch in the back of your calf muscles. And then hold the stretch for 10 seconds, then switch to the other side and repeat it 10 times for each side. When stretching your calf muscles, don't focus on pulling your big toes. You should lift your little toe and big toe at the same time toward yourself. A very important point to mention is that during normal walking, you need about 20 degrees of dorsiflexion in your ankle. To determine if you have enough flexibility, let me teach you a simple test. Place your foot against a wall and attach your heel to the wall. You should be able to separate your toes from the wall by about 20 degrees, like this. If you perform this and notice a reduced range of motion, it may include a lack of flexibility, which can create excessive pressure on your knee, ankle, and foot. In this case, a good idea is to use an elastic band around your toe with a fully extended knee and gently pull your toe toward yourself to improve flexibility. Hold the stretch for 10 to 20 seconds and then switch to the other side. Repeat the stretch for 10 times for each side. However, keep in mind, flexibility takes time. Don't apply too much pressure on your feet. Be patient, and over time, your flexibility will gradually improve. To stretch your quadriceps, lie on your stomach and use an elastic band. Flex your knee gently, and by the use of an elastic band, pull gently your ankle toward your back, like this. Pull the elastic band until the point that you feel the stretch in front of your thigh in this area. This stretch should be completely pain-free. Never feel any pain at your knee. Start with gentle stretches, holding each for 10 seconds. Repeat 5 to 6 times on each side. If you can't stretch pain-free at first, don't force it. Focus on other exercises, and over time, you'll likely be able to stretch more comfortably. To stretch your adductors, sit on the floor with your legs extended straight in front of you. Slowly place your legs apart until you feel a gentle stretch along your inner thighs. Let your legs externally rotate. When you feel the stretch in your inner thigh, hold the position for 10 seconds, then remove the pressure. Repeat 5 to 6 times for the best results. The final step is to address patellofemoral joint, which is often the source of anterior knee pain. The primary cause of knee pain is restricted patellar mobility, so the first thing to do is to improve the movement of the patella. This is done through patellar gliding. To perform patellar glides, grasp the patella as a separate bone from the surrounding tissues. Glide it in all directions. I've marked the angles and shape of the patella on the surface of my knee for a better understanding. Hold the inferior angle and pull it upward like this. Hold the gliding for about 6 seconds. Then push it downward without compressing the patella toward the knee, just toward your toes. Pull it downward, hold it for about 6 seconds. Then, by your index fingers, hold the lateral side of the patella and hold it toward the medial. Hold it for about 6 seconds, and with your thumbs, hold it to the lateral side. Then glide it in oblique directions from the above in this direction. Now, from this angle in this direction, obliquely. Glide it. Hold it about 6 seconds. Now, glide it upward but in oblique direction. And from the other side in this direction. And repeat this process for about 5 to 6 times. By incorporating these exercises into your routine, you'll improve your knee mobility, reduce pain and stiffness, and support overall knee health. Thank you for your watching. Remember, in my next video, which is part 2, we'll focus on strengthening the muscles that support your knee for long-term relief. Stay tuned and don't forget to like, subscribe, and hit the bell icon to get notified.